Hi everyone, my name is Michael from Grupo Longevidade Saudável. I'll be your host for this episode. Today we have a special guest, Dr. Natan Bryan, a little biochemist and a pioneer research on nitric oxide. Dr. Bryan is here for the second time in our
Okay.
international seminar. So how does it feel to be here with over 1,000 doctors um, bringing science and health? Tell me more about that.
Well, it's a great honor to be here. This is a great event. It's a great organization. As I was mentioned, I was here last year at the International Symposium lecturing on nitric oxide. But today, at this International Symposium on Obesity and Women's Health, um, I was really impressed by the enthusiasm and the eagerness of these physicians
Absolutely.
to learn new concepts because they're really hungry for new technologies, new ways to treat their patients and make their patients better.
Yeah, that's really amazing. So, your work on nitric oxide has inspired so many professionals and continues to open new perspectives in science and health. So, I know that you probably answered the same question all the times, but why nitric oxide?
You know, um, I've been involved in the nitric oxide research for going on 25, almost 30 years. In 1998, a Nobel Prize was awarded for the discovery of nitric oxide. So we knew it was an important molecule. And today we understand that most chronic diseases are associated with a loss of nitric oxide production. So nitric oxide is what controls blood flow, tissue
Mm-hmm.
oxygenation. I was lecturing yesterday on the role of nitric oxide in insulin signaling, in glucose uptake, and metabolic disease. But what we're finding is that the functional loss of nitric oxide is really one of the earliest events in the onset and progression
Mm-hmm.
of chronic disease. And so, 25 years ago, it was told to me by one of the guys who won the Nobel Prize that if we can figure out how to restore the production and signaling of nitric oxide, it would change the world and it would change the way we treat patients. And so that was inspiring enough for me. And we've learned a lot in the past 25 years, but there's still a lot of unanswered questions, but we're moving the field forward.
That's really inspiring, sorry. Dr. Nathan, let's say I'm a doctor starting my career. If you would recommend me, why should I study nitric oxide or put some effort into this field?
Well, I think when you understand root cause of disease
Mm-hmm.
and the mechanism of action of what happens when people start to develop symptoms
Mm-hmm.
and later on start developing diseases which are diagnosed. I think what we're finding is that nitric oxide is key. It's a pivotal point in that signaling pathway.
Okay.
Because when we look at chronic disease, there's four kind of common denominators. There's loss of
Mm-hmm.
regulation of blood flow to the affected organ,
Okay.
and then there's always inflammation, oxidative stress, and immune dysfunction. So that's all chronic diseases. It's cardiovascular disease, it's Alzheimer's, it's diabetes, it's pulmonary disease, liver disease, autoimmune disease. And so when we start to understand root cause and figure out what is leading to that lack of regulation of blood flow, what's leading to the inflammation,
Mm-hmm.
oxidative stress, and immune dysfunction, and we can correct a single molecule of nitric oxide, now it's foundational. It'll make that patient better. But what we're finding is that your body cannot and will not heal without adequate nitric oxide production. So if you want to be an effective physician
Mm-hmm.
and practitioner and ensure that your patients get better, we must first focus on the production of nitric oxide.
Got it. So let's start with the basics. I'm a listener, as I said to you earlier. I'm just here to learn about nitric oxide, and I want to know what is nitric oxide and why it's so important for our health.
Well, it's what we call a signaling molecule. It's a
Mm-hmm.
it's a signaling molecule, and it's how cells in the body communicate with one another. But it's produced in the lining of the blood vessels. It's produced in our neurons. It's produced in most cells in the body.
Mm-hmm.
But it's a gas, which makes it
Mm-hmm.
unique. So once it's produced, it's gone in less than a second. We get this burst of gas. It activates second messenger systems and starts a series of signal transduction pathways. But as I mentioned, it dilates the blood vessels. So now we're going to improve blood flow and oxygen delivery. It mobilizes our own stem cells. So now we're going to have better recovery and repair and replacement of dysfunctional cells. It prevents our telomeres from getting shorter, the ends of the
Mm-hmm. Mm-hmm.
chromosomes. And then it activates mitochondrial ATP production. So everything we know about health, longevity, and human optimization is dependent upon adequate nitric oxide production.
Wow, that's really a unique molecule that plays a really important role in our body. So, are there any surprising effects of nitric oxide that people might not know about?
I think as we advance the science of nitric oxide and start to get new therapeutics on the market so physicians can use this technology to treat their patients, to me, there's no surprises of nitric oxide. It was once called a miracle molecule. And miracles imply that it's something that we observe that can't be explained.
Okay.
But today we can explain every known action of nitric oxide. It acts as a vasodilator. It mobilizes stem cells, as we mentioned. So every biochemical and physiological effect of nitric oxide we can explain through a known mechanism of action. But a surprise finding, probably outside of medicine and in, sports performance, many athletes use nitric oxide because it's an ergogenic aid, meaning that it helps their performance. Because when we dilate the blood vessels, we improve tissue oxygenation, we activate mitochondrial ATP production, then you get less lactic acid buildup, you get better recovery, and you just perform better. And so it's a great tool for enhancing your performance. And, performance can be anything like performance in the boardroom and your cognitive executive function. It could be performance in the bedroom and dilating blood vessels and encouraging sexual function. Or it could be, performance on the athletic field. But all of those require adequate nitric oxide production to dilate the blood vessels and get oxygen nutrients to every cell in the body.
Got it. So how does we become deficient in nitric oxide?
What we're finding is that, first we had to understand, how does the human body make nitric oxide?
Right.
And once we understood that, then we can figure out, okay, what's causing a disruption in the natural production of this molecule? So there's an enzyme called nitric oxide synthase. It's found in the lining of our blood vessels. And what we're finding is that the older you get, typically the less functional that enzyme becomes, if you just look at the general population. But we know how to prevent that loss of the enzyme. But it's things like a high carbohydrate, high sugar diet, causing, glycation or, sugar or glucose is sticky. It binds to proteins and enzymes. A sedentary lifestyle, some drug therapy, things like proton pump inhibitors or antacids. And then when we look at the other pathways of production, anything that destroys the bacteria in our mouth. So fluoride in your toothpaste, antiseptic mouthwash, mouth breathing as opposed to nasal breathing. All of those has been shown to completely disrupt nitric oxide production.
That's interesting, because this is one of the questions that I wanted to ask you. I've watched some of your interviews, and you spoke about the relationship between oral health and the production of nitric oxide. Could you tell us more about that and this bacteria? What is this bacteria, and why it's important to not kill it?
Yeah. Well, there's an oral systemic link. And what that means is, this was discovered over 100 years ago, that oral hygiene predicts systemic health. So if you have poor oral hygiene, dysbiosis, a lot of cavities, periodontal disease, gingivitis, pathogenic bacteria in the mouth, then that leads to systemic inflammation and can increase your risk of heart attack and stroke. So the connection is the presence or absence of certain bacteria. So 100 years ago it was thought, there's translocation of oral pathogenic bacteria. It enters your bloodstream through bleeding gums, causes inflammation, and if you have a vulnerable plaque, it can lead to plaque rupture, heart attack, and stroke. So the therapeutic solution way back then was, let's kill all the bacteria. Right? Let's use a stringent antiseptic. But remember, 100 years ago, we didn't know about a microbiome. Today, we understand that there's bacteria that live in and on our body that are absolutely essential for human health. In fact, the bacteria that live in and on our body outnumber our human cells 10 to 1. So we're actually more bacteria than we are human. So anything that disrupts the normal microbiome is going to cause systemic disease. So we and others identified specific bacteria that live on the crypts of the tongue that are responsible for the production of nitric oxide. And so if you're using antiseptic mouthwash, killing the good bacteria along with the bad, it leads to decreased nitric oxide production, and we see an increase in blood pressure. So that tells us that these bacteria are important in maintaining normal, healthy blood pressures.
I see. I'm curious to know, you said that nitric oxide is a gas. So is it possible to measure the levels of nitric oxide in the body?
Not clinically. I mean, we can do it in the research environment. We have a gas phase analyzer. We can detect nitric oxide coming out of the exhaled breath. We can draw blood and look at certain metabolites of nitric oxide and get a pretty good understanding of of our nitric oxide production. But really what we rely on are functional measurements, things
Mm-hmm.
what we call flow-mediated dilatation, where we can look at the responsiveness of blood vessels to brief periods of ischemia, or we rely on symptoms. There's certain symptoms that manifest as a result of loss of nitric oxide production. So first one, you develop erectile dysfunction. So if you
Mm-hmm.
can't dilate the blood vessels of the sex organs, you can't get an erection. And that's in both men and women.
Okay.
Number two, if you don't correct it, you start to see an increase in blood pressure. And in America, 2 out of 3 Americans have an unsafe elevation in blood pressure. And
Wow.
then number three, as I discussed yesterday in the lecture, you start to develop metabolic disease or insulin resistance. Because without nitric oxide, insulin can't signal. And so we call that insulin resistance. And then number four, you start to develop exercise intolerance. Then eventually you get brain fog, mild cognitive impairment, and then eventually dementia and Alzheimer's. So those are the symptoms that are telling your body at multiple stages that your body can no longer produce nitric oxide.
Okay. And what are the consequences to have low levels of nitric oxide?
Well, you develop high blood pressure. You rapidly start to accelerate cardiovascular disease, which is the number one killer of men and women worldwide. And you develop sexual dysfunction because
Mm-hmm.
again, and then you have runaway inflammation. So then you start that rapid acceleration of a disease process. It could be neurological disease, it could be cardiovascular disease, it could be renal disease. But it manifests differently in different people depending upon their susceptibilities, some genetic risk factors, and other things they're doing in their lifestyle, whether it's drug therapy or oral hygienic practices.
I understand. So how can we boost these levels of nitric oxide in the body? Is there a way?
No, of course. I mean, so what I tell people is we have to stop doing the things that are disrupting the natural production,
Mm-hmm.
right? So get away from sugar and foods or diets that cause an increase in blood sugar. Number two is stop using mouthwash. If you're using an antiseptic mouthwash, you must stop. Number three, if you're using antacids, you must wean off of antacids because antacids completely shut down nitric oxide production.
Mm-hmm.
And then fluoride. Fluoride in toothpaste, fluoride's an antiseptic, so we have to remove our exposure from fluoride. Those are the big four. If you just stop doing those four things, now the body's able to produce nitric oxide. But we can stimulate that. We can start to do moderate physical exercise. We can do an 18-hour fast. We can get 20 to 30 minutes of sunlight, direct sunlight a day, and increase our vitamin D, which then activates
Mm-hmm.
nitric oxide production. And then when all else fails, based on my 25 years of research and innovations and discoveries, we have products that actually produce nitric oxide gas for you.
Understood. Dr. Bryan, is that a way that we can naturally boost those levels? Is there any foods that you can recommend for people that are listening to us?
I mean, the main thing in terms of diet is just the elimination of sugar and
Okay.
simple carbohydrates. But, there's a pathway where we use inorganic nitrate that's found primarily in green leafy vegetables.
Mm-hmm.
But then we concentrate on our salivary glands, and the bacteria, if we have the right bacteria, can metabolize that into nitric oxide active molecules. So again, an 18-hour fast, a balanced diet in moderation, high protein, good fats, and some green leafy vegetables.
That's really great. You know that these days with the internet, we have a lot of informations out there.
And misinformation.
Yeah, that's what I'm getting to. So we have fake news, misconceptions. Are there any misconceptions about nitric oxide that you'd like to clear up?
Yeah, I mean, I still hear it sometimes that nitric oxide is a free radical. It's toxic, it's damaging, and it's leading to, it's contributing to the pathology of many diseases. And that's simply not true. I think it's a misinterpretation of data,
Mm-hmm.
right? And so the people that are arguing that would have to blame fire trucks on fires, right? Because fire
Mm-hmm.
trucks always show up at fires,
Mm-hmm.
but the fire trucks do not cause the fire.
Right.
And so nitric oxide is always going to show up at a site of infection, at a site of inflammation. But just because it's there doesn't mean that it caused the inflammation.
Okay.
So it's the fire trucks putting out the fire. And so there's a misinterpretation of actual data. And so association is not causation. So
Mhm.
nitric oxide is absolutely foundational and essential for the acute inflammatory response but then also shutting down that inflammatory response and switching our macrophages from the M1 to the M2 so now we can overcome immune dysfunction and inflammation and oxidative stress. That's the role of nitric oxide.
I understand. So, Dr. Nate, we do have good news and good sources of research. So you have a book, you are an author, and I want you to talk a little more about your book for the listeners that are with us today.
The latest book's called The Secret of Nitric Oxide, Bringing the Science to Life. And what I've done in that book is two things. Number one, I tell the story of nitric oxide,
Mm-hmm.
what it is, how it was discovered, what led to a Nobel Prize, and then how my research has been able to advance the field and create new paradigms
Mm-hmm.
and new technology in nitric oxide production. So it informs and properly educates on the science of nitric oxide. And then number two, I've woven my own personal story in there, like where I came from, my education, my history, the training I had, and then the discoveries that we made along the way, and how, it really led to a lot of ridicule and opposition, because
Mm-hmm.
what we've discovered is very disruptive. And anything that's disruptive is typically met with resistance. And so I put that in there because I wanted to inspire people. Because if you're seeing resistance and people are telling you what you're trying to do can't be done, my message is stay the course, keep your head down, keep going, because that typically means you're on the brink of a breakthrough.
That's really inspiring. We do have a great news. That's what I just said. Your book is now published in Portuguese by our publishing house, Editora Longevidade. I want you to talk more about this for the listeners that are Brazilian, probably. What is the importance of this book for Brazil, for science, for health?
I think nitric oxide is a molecule without borders and boundaries. It has relevance to every person around the world.
Mhm.
Obviously, coming from America, I published this in English, but it's important. We're beginning to translate this in other languages. We start with Portuguese because, the healthcare system and the physicians and practitioners here in Brazil, I think, are pretty well advanced and more
Mhm.
progressive. I travel all over the world and lecture. But what I found is the people here in Brazil are so eager to learn, are so eager to learn new information, how they can implement it in their patient practice. So, and being associated with this conference and the Longevidade group, and them taking the initiative to translate that into Portuguese, now gives these people that education, that information in a language that they can understand, but more importantly, to conceptualize it and understand it so they can implement it in their patient practice.
Absolutely. I mean, I'm so excited to read it. But just to explain for the listeners that they are with us today, we are here at the international seminar. So we are having this conversation right now. You probably will listen to this podcast after that. So just to explain that, but we are getting to the end, Dr. Nathan. Do you want to speak a little more about something, or say anything else for people that are with us today?
Yeah, I encourage everyone to get educated, informed on nitric oxide, understand what this molecule is. And I tell people there's only two people in the world who need nitric oxide. There's the people who are sick and want to get
Mhm.
well. There's the people who are well and don't want to get sick. So nitric oxide is essential for those two patient populations. But this is a very important event and a very well organized event to bring the latest science into, and train and teach physicians to implement in patient care. But it's not just about training physicians, it's about educating the world and the masses on the
Exactly.
importance of this. So I encourage people to get informed, to get educated. Subscribe to my YouTube channel. It's Dr. Nathan S. Bryan, Nitric Oxide. Pick up the book, nathansbook.com, or you can pick it up, the Portuguese version here. I'm sure it's available
Yeah.
through Editorial
Editora
Longevidade.
Longevidade. It's a little
So
tricky,
it's a little
right?
tricky. Yeah, but no, look, I recommend it's a must read if you're concerned about your health and want to live a long, healthy life free of disease. You have to understand what nitric oxide is.
Absolutely. Could you share your socials for people that can follow you, know about your work?
Yeah, so I'm on YouTube, as I mentioned, Dr. Nathan S. Bryan, Nitric Oxide. Instagram, Dr. Nathan S. Bryan. The same handle on LinkedIn. On X or former Twitter, I'm Dr. Nitrick.
Instagram.
Instagram, Dr. Nathan S. Bryan. So yeah, follow me. We put out a lot of content, and our motivation is just to properly educate and inform on the real science of nitric oxide.
Yeah, you're really active on Instagram. I followed you. So, Dr. Nathan Bryan, thank you so much for having me today to speak to speak with us today. It was a really great conversation. I was really nervous for everything they are listening to us because this is the first time I'm doing this, but it was really, really good, really inspiring. So thank you so much for you that are with us. Thank you for joining us. Hope to see you next time. That's it for today.
Thank you so much.
Thank you.